Hi, my name is Dr. Jason Douglas, but nobody calls me that. Everybody calls me Dr. J. It's more fun. And I am a Vice Department Chair and Associate Professor of Health, Society, and Behavior in Wen Public Health. Climate change is shaping the safety of our public spaces in so many ways. For example, central to some of my research, um, increasing temperatures, urban heat, for example. We're seeing rising temperatures in places that can affect our health and well-being. Ways from exacerbating asthma to cardiovascular impacts. And this is particularly concerning in urban contexts, built environments, densely populated areas where we see urban heat island effects actually exacerbate rising surface temperatures with severe health implications for our communities, especially in our underserved communities that don't have health protective resources, like green spaces that can help to reduce land surface temperatures, like cooling centers and spaces where communities can go and seek respite during adverse heat events. Other ways that climate change is affecting public spaces, we're seeing increasing risk of flooding, for example, increasing risk of vector-borne diseases, and several implications that can result in poor health outcomes and health disparities in our underserved communities especially. I think Earth Day for our work is a call to really center environmental justice in action. Again, as an environmental health disparities researcher, I principally work in and with underserved communities to investigate the social and environmental challenges that manifest poor health outcomes in our communities. Today is really a day to center those activities, to really highlight the health impacts of climate change, of urban heat, for example, of overexposure to the bad things, air pollution, urban heat, again, and unequal access to the good stuff, like green spaces, as well as broader access to resources in our communities. I also think it's an opportunity to translate research to policy, right? Take those amazing findings that we are uncovering within underserved communities and advance policies and practices that do really advance health and well-being in our communities. And that's a major objective of our work, while also uplifting and celebrating, the resilience, the amazing work that, the communities that are really affected by environmental health disparities, climate impacts, really uplift the work that they're doing to highlight those impacts and advocate for change in our communities. And really to sort of disseminate this work as a broader call for action to the public health community, as well as a broader research community, to contribute to, again, advancing health and well-being in our communities. This project was born out of Los Angeles resident concerns about urban heat exposures within public parks. So following the community lead, as a community-engaged environmental health disparities researcher working directly with affected residents, we used EcoStress, a remote sensing instrument on the International Space Station, to measure land surface temperatures in public parks in South Los Angeles, and we compared that with public parks in West Los Angeles. And what we found is that temperatures in South Los Angeles parks are significantly hotter than those in West LA. So we had to ask why. Well, as it turns out, also using satellite imagery as well as ground truthing methods, we found that those South Los Angeles parks have constructive materials that tend to be heat absorbent, right? Whereas those parks in West Los Angeles tend to have more natural materials, natural turf, treetop canopy that helps to reduce land surface temperatures. This was rather concerning, as our findings indicate that temperatures in South Los Angeles parks can be, on average, 10 degrees hotter. As a matter of fact, we found that during an average summer day in South Los Angeles, parks were 105.8 degrees compared to West LA parks that were 91.4 degrees. This is a major difference. I'd like to point out that residents of South Los Angeles face a double burden when it comes to park inequities. Not only are the parks hotter, but they don't have equal access to public parks. For example, West Los Angeles has roughly 13 times more park space per capita than South Los Angeles. So residents of South LA don't have equal access there. And that's concerning for a number of other reasons, having spaces to recreate, play, etc. That compounded by the fact, our finding that 36% of parks in South Los Angeles exceed the burn pain threshold, which is about 110 degrees Fahrenheit, is very concerning. To put that in perspective, a first degree burn can occur at temperatures starting as low as 111 degrees, whereas second degree burns tend to occur around 140 degrees Fahrenheit, and then third degree burns 156 degrees Fahrenheit. This is so concerning because many of the things in public parks in South LA that we measured, for example, children's playgrounds, exceeded 160 degrees Fahrenheit on a summer day, which could lead to a third degree burn. I'm a father. I used to take my daughter to these playgrounds. I could only imagine putting her on a slide and seeing her in pain. This is something that no parent wants to see and nobody in our communities wants to see. While some of the findings that come out of these projects can be very challenging to reckon with, I do want to uplift the amazing work that community and academic partnerships can produce. For example, in this project, working with Communities for a Better Environment, an environmental health and justice nonprofit organization that's been working successfully to address environmental inequities and advance environmental justice in communities for over 40 years. It's with support from research like this and these types of partnerships that have really advanced policies and advanced our partnerships' abilities to really advocate for our communities and uplift community health and well-being.